When circulating blood reaches the capillaries, part of its fluid content passes through them into the surrounding tissue as tissue fluid. Most of this tissue fluid re-enters the capillaries at their venous ends. Some of it is, however, returned to circulation through a separate set of lymphatic vessels. These vessels begin as lymphatic capillaries, which drain into larger vessels. Along the course of these lymph vessels, there are groups of lymph nodes. Lymph vessels are difficult to see. Lymph nodes are small bean-like structures that are usually present in groups. Upon clinical examination, these are not normally palpable in the living subject. If so, what is the importance for the medical student to learn about the lymphatic system? The reason is, the lymph nodes often become enlarged in disease, particularly by infection or by malignancy in the area from which they receive lymph. They then become palpable, and examination of these nodes provides valuable information regarding the presence and spread of disease. That is why it is important to learn about the lymphatic drainage of the different parts of the body. Let us dive into the details of lymph nodes and lymphatic drainage. The lymphatic drainage of the upper limb follows the unnamed lymph vessels, which start in the hand and run upwards in the direction of the axilla. When they reach the cubital fossa, the lymph goes through the cubital nodes. From here, lymph vessels run superiorly to drain into the axillary lymph nodes. The main lymph nodes of the upper limb are the axillary lymph nodes. These comprise anterior, posterior, lateral, central, and apical groups. We have already talked about the axillary lymph nodes in a previous video when we learned about the axillary region. Let's just revise it once, as they are of great importance. The axillary lymph nodes drain lymph vessels from lateral quadrant of the breast, superficial lymph vessels from thoraco-abdominal walls, and vessels from the upper limb. The lymph nodes are arranged in 5 groups. Anterior or pectoral group of lymph nodes lies along the lateral thoracic vessels along the lower border of the pectoralis minor. They drain lymph from the lateral quadrant of the breast and superficial vessels from the anterolateral abdominal wall. Posterior or the subscapular group of lymph nodes. As the name indicates, these nodes lie in front of the subscapularis muscles. You can also remember is as that they lie along the course of the subscapular vessels. They receive superficial lymph vessels from the back. As for the lateral group, they are present on the medial side of the axillary vein and lie along the axillary vein. They receive lymph from the upper limb. The central group of axillary lymph nodes, present at the center of the axilla, they receive lymph from the 3 groups mentioned before, that is anterior, posterior, and lateral groups. Lastly, we have the apical group of axillary lymph nodes. These nodes are present at the apex of the axilla, just lateral to the first rib. They receive lymph from other axillary lymph nodes. Out of these 5 groups of axillary lymph nodes, the lateral group is the main group of nodes to receive lymph of the upper limb. Other lymph nodes of the upper limb are the infraclavicular nodes lie in or on the clavipectoral fascia along the cephalic vein. They drain the upper part of the breast and the thumb with their web. The superficial cubital or supratrochlear nodes lie just above the medial epicondyle along the basilic vein. They drain the ulnar side of the hand and forearm. A few other deep lymph nodes lie in the following regions. Along the medial side of the brachial artery. At the bifurcation of the brachial artery, that is, deep cubital lymph node. Occasionally along the arteries of the forearm. So we can say that in the arm there are 2 types of lymphatics, superficial and deep lymphatics. Superficial lymphatics are the ones we discussed before. They are much more numerous than the deep lymphatics. They collect lymph from the skin and subcutaneous tissues. Most of them ultimately drain into the axillary nodes, except for a few vessels from the medial side of the forearm drain into the superficial cubital nodes. A few vessels from the lateral side of the forearm drain into the delta pectoral or infraclavicular nodes. The dense palmar plexus that we talked about in the previous section drains mostly into the lymph vessels onto the dorsum of the hand, where these continue with the vessels of the forearm. Lymph vessels of the back of the forearm and arm curve round their medial and lateral surfaces and ascend up to reach the floor of the axilla. Thus, there is a vertical area of lymph shed in the middle of the back of the forearm and arm. As for the deep lymphatics are much less numerous than superficial lymphatics. They drain structures lying deep to the deep fascia. They run along the main blood vessels of the limb and end in the axillary nodes. Some of the lymph may pass through the deep lymph nodes present along the axillary vein, as mentioned above. That is all about cutaneous nerves of the upper limb and their distribution, as well as the superficial veins and lymphatic drainage of this region. Check out our other lectures in the upper limb series to gain more knowledge.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.